Most seniors with sciatica are taking more than one medication every single day: a pain reliever for the nerve pain, a blood pressure pill, a sleep aid, a heart medication, and nobody, not the pharmacist, not the prescribing doctor, not the specialist, has ever sat down with them and explained what happens when two specific combinations of these common everyday medications interact inside the body of a senior over 60. Not because doctors do not care, because a standard appointment simply does not have time for this conversation. Tonight, I am having it. Two specific medication combinations that seniors with sciatica are taking together every single day, say, combinations that research identifies as specifically dangerous for adults over 60, and exactly what to discuss with your doctor before your next dose. And real quick, if someone you know is taking multiple medications for sciatica and other health conditions, pause right now and send this video to them. What they are about to hear could be genuinely important for their safety. And if you are not subscribed yet, hit that subscribe button right now. Every week, this channel brings you honest, practical information that most appointments never have time to cover. Now let us get completely into this. My name is Dr. Michael Kent, 20 years working with senior patients managing sciatica and chronic nerve pain. And in those 20 years, one of the most consistent and most preventable situations I have encountered is this. A senior comes in managing their sciatica with one medication prescribed by their pain specialist, managing their heart with another, prescribed by their cardiologist, managing their sleep with a third, recommended by their general practitioner, and not one of those three providers has reviewed the complete picture of what this senior is taking together every single day. Each prescription is appropriate in isolation. The combination is the problem. And tonight I am making sure that what happened to the patient in our story tonight never happens to anyone watching this video. Before I explain both dangerous combinations and let me share a story, details change to protect privacy. A patient came to me, a senior in their early 70s, who had been managing sciatica for approximately 14 months alongside high blood pressure and occasional insomnia. 3 separate doctors, 3 separate prescriptions, an anti-inflammatory pain reliever for the sciatica, a blood-thinning medication for the cardiovascular condition, and a sleep aid for the insomnia that the sciatica pain was causing every single night. All 3 prescribed by doctors who knew their part of the picture, none of whom had seen the complete picture together. They had been taking all 3 medications exactly as directed for over a year. They felt reasonably managed, not great, but functional. They had noticed some things that concerned them slightly, more bruising than usual. Morning grogginess that lasted longer than it should, a general heaviness and cognitive slowness in the first few hours of every day that they had simply attributed to aging. They mentioned these observations almost apologetically, as if they were complaining unnecessarily. At a routine appointment, I reviewed their complete medication list for the first time. I immediately identified 2 concerning interactions: the combination of their anti-inflammatory pain reliever with their blood-thinning medication, explaining the unusual bruising, and on the nights they took their sleep aid alongside their nerve pain medication, a second dangerous interaction explaining the excessive morning sedation and cognitive heaviness they had been normalizing for months. I referred them back to their prescribing physicians with a detailed written summary of the interactions I had identified, specifically requesting a complete medication review. Their doctors adjusted the protocol. Within 3 weeks, the patient reported feeling significantly more alert during the day. The bruising resolved. The morning cognitive heaviness that they had accepted as just how aging felt lifted. A follow-up blood test revealed that one interaction had been affecting a key health marker without anyone connecting it to the medication combination for over a year. They told me I had been taking all of these exactly as prescribed for over a year. Nobody ever told me they could be a problem together. Tonight I am telling you what nobody told them, and what you need to know before your next dose. Now here is what most seniors never understand about medication interactions. And this changes everything about how you approach your daily medication routine. When you are in your 30s or 40s, your liver and kidneys process medications quickly and efficiently. Interactions between medications are real, but your body compensates relatively well. When you are over 60, everything changes. liver enzyme activity slows. Kidney clearance declines. The blood-brain barrier becomes more permeable. Fat-to-muscle ratio changes, affecting how medications distribute through the body. And the neurological systems controlling balance, breathing, and cognition become more sensitive to the sedating and CNS depressant effects of multiple medications taken simultaneously. This is why medication combinations that a younger adult manages without significant consequence can be genuinely dangerous for a senior over 60. Not because the medications are wrong for seniors in isolation, because the aging body processes their combination differently. And most standard medication dosing and interaction guidance was not developed specifically with the senior physiological profile in mind. With that context, here are both dangerous combinations in complete detail. Dangerous combination 1, anti-inflammatory pain relievers with blood-thinning medications. This is the most common dangerous combination I identify in senior sciatica patients. Anti-inflammatory pain relievers, ibuprofen sold as Advil and Motrin, naproxen sold as Aleve and diclofenac, are among the most commonly recommended medications for sciatica pain management. Blood-thinning medications, including warfarin sold as Coumadin, daily aspirin for heart protection, clopidogrel sold as Plavix, and newer anticoagulants including rivaroxaban sold as Xarelto and apixaban sold as Eliquis, are among the most commonly prescribed medications for seniors over 60 managing cardiovascular conditions. When these two categories are taken together, the interaction creates two specific and serious risks that are significantly greater in adults over 60 than in younger patients. The first risk is significantly increased bleeding. Anti-inflammatory pain relievers inhibit platelet aggregation and they reduce the ability of platelets to clump together and form clots. Blood-thinning medications also reduce clotting through their own mechanisms. When both are present simultaneously, the combined anticoagulant effect is significantly greater than either medication produces alone, creating a risk of serious bleeding events. The most common manifestation is gastrointestinal bleeding, which presents as stomach pain, black or tarry stools, or vomiting material that looks like coffee grounds. In serious cases, internal bleeding can occur without obvious external signs until it becomes medically significant. The unusual bruising that the patient in our story experienced was an early and relatively mild sign of this interaction, one that went unconnected to the medication combination for over a year. Research published in the journal Pharmacoepidemiology and Drug Safety found that concurrent use of NSAIDs with anticoagulant medications produced a significantly elevated risk of major bleeding events in adults over 65. With the risk being substantially higher than for either medication class alone. The patient from our story was experiencing a real and documented biological consequence of their combination, not an unusual response, but a predictable one that the research identifies clearly. The second risk from this combination is kidney stress. Anti-inflammatory pain relievers reduce blood flow to the kidneys through their prostaglandin-inhibiting mechanism. Many blood pressure medications, particularly ACE inhibitors and ARBs commonly prescribed alongside blood thinners for cardiovascular management, also affect kidney blood flow through different mechanisms. The combination creates a compounded reduction in kidney perfusion. Research has associated this combined effect with acute kidney injury risk, particularly in older adults whose baseline kidney function has already declined with age. The health marker that was affected in our patient's follow-up blood test was a kidney function marker, elevated in a way that had been present for months without the cause being identified. What does this mean practically for you? If you are taking any anti-inflammatory pain reliever for your sciatica pain management and any blood thinning or cardiovascular medication, this combination deserves a specific and explicit conversation with your prescribing physician. Not an assumption that because both were prescribed by doctors it must be safe in combination. A direct question, a specific review at your next appointment. There are genuine alternatives for sciatica pain management that do not carry this interaction risk, including acetaminophen for pain relief, topical pain preparations that are absorbed locally rather than systemically, and the natural anti-inflammatory approaches that this channel covers extensively. Your physician can guide you toward the safest pain management approach for your specific medication profile. Dangerous combination. 2. Gabapentin with sleep aids or sedating antihistamines. The second combination is equally common and equally under-discussed. Gabapentin, prescribed for sciatica nerve pain under brand names including Neurontin, is one of the most commonly prescribed nerve pain medications for seniors with chronic sciatica. Sleep aids, including over-the-counter options like diphenhydramine sold as Benadryl, Unisom, and Zizquil, as well as prescription sleep medications including Zolpidem sold as Ambien and Azopiclone sold as Lunesta, are similarly prevalent in the senior population where sleep disruption from chronic pain is extremely common. The combination creates a specific and serious risk through a mechanism called additive central nervous system depression. Gabapentin is a CNS depressant. It slows neurological activity to reduce nerve pain signaling. Sedating sleep aids are also CNS depressants. They slow neurological activity to induce sleep. When taken together, their CNS depressant effects combine, producing a level of sedation and neurological slowing that neither medication produces alone at the same dose. For seniors over 60, this combined CNS depression creates 3 specific dangers that the patient in our story was experiencing without recognizing their source. The first is respiratory depression risk. Both gabapentin and sedating medications slow the neurological drive to breathe. Combined, this slowing can become significant, particularly during the deepest sleep stages between 2 and 4 in the morning when breathing is already most vulnerable in seniors with age-related respiratory changes. Research published in the journal Pharmacotherapy found that concurrent use of gabapentin with CNS depressant medications was associated with significantly elevated rates of respiratory events in adults over 65. The second danger is fall risk. The residual sedation from the combined effect of both medications persists into the morning hours, producing the cognitive heaviness, coordination impairment, and balance difficulty that the patient in our story had been experiencing every morning. For seniors with sciatica who already have compromised proprioception and balance from nerve damage, adding a layer of medication-induced neurological impairment to already compromised balance systems creates a fall risk that is significantly greater than the sum of its parts. The third danger is cognitive impact. The combined CNS depression from both medications taken regularly produces cumulative cognitive effects: reduced processing speed, reduced working memory function, reduced attentional capacity that can be misattributed to dementia or normal cognitive aging rather than recognized as reversible medication effects. In the patient from our story, the cognitive heaviness resolved within 3 weeks of the medication adjustment, confirming that what had been normalized as aging was in significant part a medication interaction effect. Research published in the journal JAMA Internal Medicine found that regular use of CNS depressant medication combinations in adults over 65 was associated with significantly elevated rates of cognitive impairment, fall-related injuries, and emergency presentations, with the risk increasing substantially when 2 or more CNS depressant medications were combined regularly. What does this mean practically for you? If you are taking gabapentin for sciatica nerve pain and any sleep aid, prescription or over-the-counter, bring this specific combination to your doctor's attention at your very next appointment. Ask specifically whether a complete CNS depressant review has been conducted for your medication protocol. Ask whether there are safer alternatives for managing the sleep disruption your sciatica causes. Ask whether the morning cognitive effects you may be experiencing have been assessed in the context of your medication combination. Here is your complete practical action plan. Step 1. Tonight, write down every single medication you take. Prescription and over-the-counter, including sleep aids, pain relievers, vitamins, and supplements, every single thing. Many seniors are genuinely surprised by how long this list is. Step 2. At your very next medical appointment with any of your doctors, hand them this complete list and say these specific words. I would like to request a complete medication interaction review. I want to make sure nothing on this list interacts with anything else. Step 3. Specifically ask about both combinations discussed tonight. If you take any anti-inflammatory pain reliever and any blood thinning or cardiovascular medication together, ask about that combination directly. If you take gabapentin and any sleep aid, prescription, or over-the-counter, ask about that combination directly. Step 4. If your doctor identifies an interaction, ask what the safest alternatives are for managing your sciatica pain specifically. There are effective natural approaches, topical options, and medication alternatives that may be significantly safer for your specific combination profile. This is not about distrust of your doctors. Every doctor who prescribed each medication in our patient's story made an appropriate individual decision. The gap was not in any individual prescription. The gap was in the complete picture review that modern healthcare, with its necessary specialization, can sometimes miss. You can close that gap yourself with a 5-minute conversation at your next appointment, armed with the right questions, starting tomorrow. In 20 years of practice, the medication interaction reviews I have facilitated for senior patients have consistently produced meaningful improvements in their well-being, and in several cases have prevented serious adverse events. Not because their doctors were negligent, because no single appointment had previously looked at the complete picture. Tonight you have seen part of that picture. Tomorrow, complete it with your doctor. Now, before you go, drop a comment right now. Tell me your age and your city. And tell me, are you currently taking multiple medications for your sciatica alongside other health conditions? Have you ever had a complete medication interaction review? I read every single comment personally. Share this with someone whose sciatica management involves multiple medications. Subscribe and turn on notifications, because every week this channel brings you information that could genuinely matter for your health and your safety. One conversation with your doctor, 5 minutes, starting at your very next appointment. This video is for general educational and informational purposes only. It does not constitute medical advice and does not create a doctor-patient relationship. All patient stories have been changed to protect privacy. Individual results vary. Never stop, change, or adjust any prescribed medication without consulting your healthcare provider first. The medication interactions discussed represent general educational information based on published research. Your specific medication situation requires individual professional assessment by a qualified healthcare provider who knows your complete medical history. Always inform all your healthcare providers about every medication supplement and over-the-counter product you take. Drug interactions affect individuals differently based on age, weight, kidney function, liver function, and other health factors. Dr. Michael Kent is a senior health educator with 20 years of experience in senior wellness, not a licensed physician or pharmacist. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease or condition. Always consult your qualified healthcare provider for all medication management decisions. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion advised.